For decades, the entire concept of health insurance rested on a single premise. You pay your premiums every month, and you get a safety net. When you get sick, the money is there to cover your care. But on the morning of December 4th, 2024, the CEO of United Healthcare, the largest insurance company in America, was killed on a Manhattan sidewalk. Within hours of the incident, the news dominated every major network. The public reaction to the incident defied every expectation of corporate America. There was very little national mourning. Instead, social media flooded with dark jokes, and polls revealed that 7 in 10 Americans assigned moderate responsibility to the insurance industry's own practices. Millions of people who had fought with their insurers at the worst moments of their lives looked at what happened and felt a grim recognition. They understood the anger because they recognized a system that actively generates its wealth by denying the very service it is paid to provide. To grasp how that system operates, you have to look at the sheer scale of United Health Group. This is an enterprise generating nearly $450 billion in annual revenue, with an insurance division that covers roughly 50 million Americans. That is nearly 1 in 6 people in the country paying into their system. The company is bound by a rigid mandate from Wall Street. To deliver double-digit returns year after year, it must execute a highly specific calculation, collect the maximum possible amount in premium revenue, and pay out the absolute minimum in medical claims. The machinery of American health insurance does not exist to facilitate healthcare delivery. It is a highly optimized financial extraction engine. This chart breaks down the medical loss ratio, the central number governing the industry. When an insurance company pays a doctor, that payout is mathematically classified as a loss. As medical claims shrink, the stock line rises, driving surging profit margins. The primary tool used to suppress those medical payouts before care even happens is a bureaucratic hurdle called prior authorization. Before a doctor can proceed with a surgery, an MRI, or even prescribe a chronic illness medication, the insurer must explicitly approve it. The toll this takes on medical providers is severe. Physicians report completing an average of 39 prior authorizations every single week. That means doctors are spending significant portions of their working hours fighting paperwork and algorithms instead of actually treating patients. This friction is entirely deliberate. The system is constructed to make navigating a covered claim so complex and exhausting that getting approval feels nearly impossible. Recently, insurers found a way to scale this friction. They poured money into AI algorithms capable of rejecting claims in milliseconds, entirely bypassing human review. This grid visualizes a lawsuit against a tool used by United Healthcare. The suit claims the algorithm had a 90% error rate when denying extended care for elderly patients. 9 out of 10 denials generated by the system were allegedly wrong. Using such inaccurate algorithms seems like a massive financial risk, but insurers rely on a calculated gamble. When providers appeal denials, they win over half the time, but the system relies on patience. Less than 1% ever appeal their claims. That tiny sliver generates a massive financial windfall. By automating rejections, insurers save between $80 and $110 billion annually. They simply bank the difference every time a patient gets sick, gets overwhelmed, and walks away. The AI denial machine operates by weaponizing exhaustion. It mathematically converts sick, vulnerable people who lack the energy to fight into guaranteed corporate profit margins. 4 months after the December incident, on April 17, 2025, United Health Group held an earnings call that shocked Wall Street. The executives disclosed they were caught completely off guard by something they called excess utilization. In corporate terminology, excess utilization simply means that sick patients were actually going to the doctor and receiving medical care. This chart demonstrates the immediate market reaction. Because too many sick people used their insurance, United Health stock plummeted 22% in a single trading session. $100 billion of market value was wiped out in a day. That massive financial collapse laid the company's entire architecture bare. It exposed a business model so deeply reliant on denying care that it physically shatters the moment it actually has to fund healthcare. In Washington, the response was heavy on speeches and light on action. Despite deep public fury and vast bipartisan support in both chambers, Congress passed a continuing resolution that completely failed to include prior authorization reform. Instead, nearly 50 major insurers signed a voluntary pledge to streamline their processes. The CMS administrator openly noted that the companies were acting because there was violence in the streets, not out of a sudden ethical awakening. And because it was a voluntary pledge, there was no enforcement mechanism attached. Today, the core system remains completely intact, and United Healthcare is implementing 25% rate increases on some of their plans. The algorithms are still running. Essential care is still being denied. The physical machine wasn't stopped, but the illusion of safety around it was permanently destroyed. 50 million Americans looked directly at the brutal math behind the denial industry, and a national reckoning began that can no longer be ignored.